Voriconazole Vfend. 1. Basic information. Generic name, Voriconazole. Drug class, triazole antifungal. Second generation azole. Brand names, Vfend. Dosage forms. Tablets, 50 milligrams, 200 milligrams. Oral suspension, 40 milligrams per milli after reconstitution. IV injection, powder for reconstitution, contains cyclodextrin, vehicle. Number 2 definition. Voriconazole is a broad-spectrum antifungal medication that inhibits fungal cell membrane synthesis. It is the drug of choice for invasive aspergillosis and is often used in immunocompromised patients, e.g. transplant recipients, cancer patients, HIV patients, with life-threatening fungal infections. Mechanism of action. Inhibits the fungal cytochrome P450 enzyme, lanosterol fortidimethylase. Prevents conversion of lanosterol, ergosterol, a critical component of fungal cell membranes. Without ergosterol, fungal cell membranes become defective, increased permeability, cell death. Selective for fungal enzymes, but also inhibits human CYP450 enzymes, which leads to many drug interactions. Number 4. Uses. Treats serious systemic fungal infections. Often used when other antifungals like amphotericin B or fluconazole are ineffective or not tolerated. Number 5. Indications FDA approved. Invasive aspergillosis, first-line treatment. Candidemia in non-neutropenic patients. Esophageal candidiasis when fluconazole is not suitable. Serious infections caused by Psittasporium or Fusarium species. Off-label. Empiric therapy for febrile neutropenia in immunocompromised patients. Salvage therapy for other resistant fungal infections. Number 6. Contraindications. Absolute hypersensitivity to voriconazole or other azole antifungals. Co-administration with drugs that are metabolized by CYP450 and can cause serious or life-threatening reactions including rifampin, rifabutin, reduce voriconazole levels drastically, carbamazepine, phenobarbital, strong CYP inducers, sirolimus, toxic accumulation, ergot alkaloids, ergot toxicity, St. John's wort, reduces voriconazole levels, pymazide, quinidine, QT prolongation risk. Number 7. Precautions before taking. Liver disease, voriconazole is hepatotoxic, monitor LFTs regularly. Kidney disease, IV formulation contains cyclodextrin, which accumulates in renal impairment. Heart disease can prolong QT interval, risk of arrhythmia. Vision problems may cause visual disturbances, blurred vision, photophobia, hallucinations. Photosensitivity, long-term use associated with skin damage and skin cancer. Avoid direct sunlight, use sunscreen. Pregnancy, category D, risk of fetal harm. Use only if benefit outweighs risk. Breastfeeding, not recommended. Children, dose adjustments required, higher clearance in children. Elderly may have altered drug metabolism, dose adjustment needed. Number 8. How to use. Oral. Take at least 1 hour before or 1 hour after meals. Empty stomach, better absorption. Shake oral suspension well before use. IV, administered in hospital setting under medical supervision. Number 9. Dosing information. Adults or 15 years. Invasive aspergillosis. Loading dose IV 6 milligrams per kilogram every 12 hours for 2 doses. Maintenance IV 4 milligrams killing every 12 hours. Oral maintenance 200 milligrams every 12 hours, 100 milligrams at 40 kilograms. Candidemia non-neutropenic, same as above. Esophageal candidiasis 200 milligrams orally every 12 hours for at least 14 days. Children, 2 to 12 years, higher clearance, use weight-based dosing. Loading, 9 milligrams kilograms every 12 hours for 2 doses. Maintenance, 8 milligrams per kilograms every 12 hours. Monitoring, therapeutic drug monitoring, TDM, target trough level 1 to 5 micrograms per milliliters, 1 treatment failure risk, open quote, 5 toxicity, neurotoxicity, liver damage, close quote. Number 10, misdose, overdose. Misdose, take as soon as remembered. Skip if near next dose, do not double. Overdose, symptoms include visual disturbances, hallucinations, confusion, cardiac arrhythmias, liver injury. Seek emergency medical help. 11. Stop or avoid taking. Stop immediately and seek medical attention if severe skin reaction, rash, blistering, peeling, signs of liver failure, jaundice, dark urine, severe fatigue, irregular heartbeat, fainting, chest pain, severe photosensitivity or skin lesions. Number 12. Side effects, very common, 10%, visual changes, blurred vision, altered color perception, photophobia, fever, rash, nausea, vomiting, diarrhea, headache, hallucinations, elevated liver enzymes. Serious but less common hepatotoxicity, hepatitis, liver failure, severe skin reactions, Stevens-Johnson syndrome. 10. QT prolongation, torsades de pointes. Photosensitivity, increased risk of squamous cell carcinoma with long-term use. Pancreatitis, rare. Number 13, vital information, requires regular blood monitoring. Liver function, AST, ALT, bilirubin. Kidney function, creatinine, BUN, especially for IV form. Electrolytes, K+, Mg2+, Ca2+, to reduce arrhythmia risk. ECG monitoring in patients at risk of QT prolongation. Ophthalmologic exams if treatment in 28 days. Avoid driving at night initially. Visual disturbances. Number 14, drug interactions. Voriconazole is both a substrate and strong inhibitor of CYP2C19, CYP23A4, many drug interactions. Increases levels, toxicity, immunosuppressants, cyclosporine, tacrolimus, sirolimus. Warfarin, the INR, bleeding risk. Benzodiazepines, midazolam, triazolam. Sulfonylurias, hypoglycemia. Statins, myopathy, rhabdomyolysis. Calcium channel blockers, verapamil, nifedipine, hypotension. Methadone, risk of arrhythmia. Decreased by reduced effectiveness, rifampin, rifabutin, carbamazepine, phenobarbital. St. John's wort, other cautions, concomitant QT prolonging drugs, quinidine, pemazides, some fluoroquinolones, antipsychotics, macrolides. Proton pump inhibitors may voriconazole levels. Thank you. Have a nice day.